Hello and good evening, everyone. I think we have good enough forum to be able to start the webinar. I'd like to confirm that everyone can hear me.
Yes, we can.
Thank you. Thank you very much. So we want to welcome everyone to this webinar this evening. Here at Nodes Weight Loss Clinic, we're going to be talking about the topic of weight loss after pregnancy, what every mom should know. And it's quite a touchy subject because a lot of moms struggle with losing the weight after the pregnancy because it can be quite a struggle. You might have tried to lose weight before pregnancy and it was very easy for you, but after childbirth, you may find it becomes a bit more difficult, and there are different factors around that. And there are also solutions to help you lose that weight safely and effectively. And that's what we're going to be going through this evening. So our speakers this evening will include our nutritionist, Margaret, who's here on the call with us. We'll also have Akini, who's our bariatric counselor, and our lead surgeon, Professor Almantas Maleskas. Just a brief overview of what we do here at Nodes Weight Loss Clinic. We are a bariatric clinic that's internationally recognized with over 30 years of experience. And what we offer is weight loss, medical weight loss options. And this could be either surgical or non-surgical. And for you to know which option will work best for you, usually we'll book you in for a consultation so that the doctor can assess you, and based on the criteria for each procedure, then you're qualified to go ahead. Some of the procedures we have are the bariatric surgeries, which is the gastric sleeve and the gastric bypass. And then on the non-surgical side, we have the gastric balloon, the endoscopic sleeve gastroplasty, and we also have a nutrition and therapy program. So as we begin this session, maybe I can invite Professor Maleskas to tell us about some of the procedures that would be most suitable for a mom after pregnancy, after she's just had a child, and when is the right time to start thinking about weight loss.
Sorry, I just put on my camera. And hello, everybody. So I'm also currently in the conference, but I have taken a break. We have Nordic and Baltic Bariatric Surgery Conference now in Oslo. Actually, there was not a topic about weight loss after pregnancy, so but I think it's very important, and I'm really happy that we touched this topic. Why? One of the main reasons were, for instance, that after pregnancy, if the woman retain their weight and they do not lose the weight, they have a much higher risk to get problems with obesity, and that is already shown by multiple studies that it's very important to address this issue as early as possible. But there are some tricky moments in all this that we will talk about. And for sure, there is a classical weight loss treatments like nutrition, yes, diet, and physical activity. It's very important also. So Margaret and Akini, Margaret will speak about this, Akini more about psychological and behavioral weight loss. And maybe later on at the end, I can mention some things or the latest news from the research about the medications, or what we know or we do not know about the medications. Can they be used or not after the pregnancy? So I would consider this like my short introduction, and I would give over the word to Eva to continue.
Thank you very much, Professor. I think we can start possibly with Margaret. And what are some of the challenges you see among mothers who are trying to lose weight after pregnancy?
Hello, everyone. Greetings. Thank you, Eva. Our topic of today, weight loss after pregnancy. Foremost, I will begin with this, that pregnancy and childbirth, they bring a significant changes to a woman's body. We all have to agree to that. And a healthy postpartum weight loss, it actually takes time. It's not a single day thing. Remember, you've carried this pregnancy for 9 months. So that is quite big numbers. And as a nutritionist, I would say that our focus should be about, recovery, nourishment, and, building sustainable habits rather than rapid weight loss. So to answer to you, Eva, my biggest, the one that I've come across is people, or rather women, wanting to lose this weight in a very rapid way. And, weight loss should be gradual and it varies from one person to another.
Okay, thanks for that, Margaret. And so maybe I can bring Akinyi to this part of the discussion where Margaret has said that someone is trying to lose weight in a very short time. From a mental health perspective as a counselor, how do you help patients overcome this unrealistic expectation and start to understand that this will take some time?
Okay, thank you so much, Eva. And thank you everyone for coming into the webinar. So yes, setting realistic goals. The first process that we have when we are, consulting with our patients, or when I'm consulting the patients, is that getting them to be prepared is very important, because they need to understand first what treatment they are, choosing to go on with. And again, getting to know themselves and also their bodies. It is very important to set those realistic goals. And we help you in understanding that process, because when a patient is not prepared, adhering to treatment becomes a problem. So during our consultations, we actually take the time to be able to explain to you what is it about. What we also want to understand, what are your goals and how we can be able to achieve that. So preparedness is very important. Ask all the questions and also disclose. Share about your journey. We normally ask, where did it start from? How has it begun? Share about your journey, because weight loss is not it's not one size fits all. No. It is very specific to each and every person. And in the fact that we are talking about weight loss after pregnancy, for those who are here and have gone through the journey of pregnancy, the way each pregnancy is very unique, so is your weight loss even after that. So Eva, I hope I've answered your question. Later I'll get to share the link on how as our mental health can align with our weight loss after pregnancy and why it is very important.
Thank you very much for that insight, Akinyi. I think you've really captured how to help patients adjust to the expectations and how to adjust to the weight loss and the speed of it as well. The next question I'll pose to Professor. When is the best time for a mother to try and start losing weight through a medical procedure after pregnancy?
Thank you, Eva. It's, first of all, I just comment a little bit on Margaret's point where she said about rapidly losing the weight. So actually, what is considered in the medical literature and what is considered maybe to be optimal, that is losing or normalizing your weight after the pregnancy within about 6 months. This is considered like to be normal, because for those who fail to normalize their weight within 6 months, then the risk of retaining this and already becoming like overweight or obese in the future increases significantly. So this is not a rapid weight loss, but about 6 months, despite the status of breastfeeding or not, is considered like key time. So that's why it's already important to start losing the weight earlier, because I think the main topic that we have today is actually weight loss after pregnancy, and thus here we have to understand that it needs to start pretty early in the process, yes, because the longer you are maintaining the unhealthy weight, and it could be the more difficult later on also to lose. So having the goal, I think, is very important also about the motivation and having the goal, because without the goal or normalizing the weight, for instance, saying, okay, I am now after delivery, but still there are difficult first 6 months or whatever I will do later on. So that means that you are increasing the risk that it would be more difficult for you to lose. So despite breastfeeding, despite a rather difficult situation, I understand first these 6 months, it's still important to manage nutritional intake and to start exercising, because exercising is always good. Why? Because after the pregnancy, after delivery, the body is changing, yes, and lactation starts, and there is needs for more nutrition, and we have or the ladies has to nutrient the baby. So that means that if you start losing the weight and without exercising and you are breastfeeding, there is a much higher risk, or without eating properly, it's much higher risk that you may start losing the muscles. So and this is like the proteins, and this at the end of the day is not really what we are aiming at. So that's why if we look at the literature that is available about this and what are the recommendations, so absolutely recommendations are to combine nutrition with physical activity, and as early as possible, and to have the goal that by 6 months more or less to normalize the weight. Is it easy or not? Yes, everybody understands that it's not easy, and maybe it's even after delivery and after pregnancy, even slightly more complicated than in normal cases. But this is very important for your health and for the future. And here, yes, I completely agree that you may need also additionally on top of this, I mean, nutrition and some physical activities. On top of this, you may need psychological support or psychological therapy that a kidney may provide. And what is very important, we have a very specialized program for health program that is for healthy eating and lifestyle. So that means that this program is not exactly for weight loss in itself. It's a more complex. It's for teaching you again how correctly to eat. And in this program is also incorporated, could be incorporated, Margaret, who helps you to understand how you have to eat properly and what nutrition you have to get to breastfeed your baby, but also meanwhile, also to try to start losing the weight. And then this program also helps you to cope with your mind and with the thoughts you have, because there is also a lot of stress changing the life, changing situations and so on these 6 months. So it's very important to address your mind. Regarding medications, what maybe is a good news, the last reports that they show that the medications, even if they penetrate the milk, mother milk, they are found in very, very tiny concentrations there. So they do not have actually impact directly on the baby. But still, what we do not know if these medications given to the mother do not change the quality of the milk, yes, which mother milk with which she is breastfeeding. And even a smaller changes in this milk may have an impact on your baby development. So currently, if we take like in the wider perspective, there is not recommended these medications while breastfeeding. So what does it mean? It means that what is left a classical approach, nutrition and physical activity, and on top some psychotherapy called behavioral therapy.
Thank you for that, Professor. I would ask for maybe Akinyi to comment on that as well. Maybe now that we have injections and medications for weight loss, someone might think it's a quick fix and may want to rush to it, especially after pregnancy. What would your advice be to a mother who wants to start on the medication, given also the information that Professor has shared with us?
Okay, thank you. Thank you for that. As for every weight loss treatment, we need to find out, is it suitable for you? Because we normally just say, this is it, this is what I would want, but is it suitable for you? And so the consultation begins with the doctor. Okay, and once the doctor has been able to just clear you out, then they can be able to actually direct you on the right kind of medication. Now, when it comes to weight loss, after pregnancy, it's important, as Professor was mentioning, there are a lot of changes that are happening around you, and they happen, to every mother. And so that adjustment, of course, influences our mental wellness. And I'd like to highlight on, I would say, 3 aspects that it may influence our mental wellness and subsequently also impact your weight loss journey. So when we're having maternal mental health, we call them the disorders, but disorders is just that an interruption in daily life, and we acknowledge that it's there. One is anxiety. Anxiety is persistent worry. There is some tension happening around there. It could be because you're facing, this is a new phase, in life. So if you've actually given birth to that baby, now you have to adjust. Some experience maternal loss, that's also an adjustment. So there's a fear that's happening there. So it is something that women do experience. Another aspect is stress. Stress because life is changing, okay? And stress, we would say it's a response to pressure and challenges. This is perhaps something you have to adjust to. And so it's also causing you that particular stress. And then another that, yes, we've had this term, there's postpartum depression or depression, and it can happen consistently over time. It can be seasonal, and some it's even medicated. And I'd also like to mention trauma, and especially birth trauma, depending on how your delivery is from the moment you step into hospital, even before that, and even after that. And that influences our mind a lot, and also now cause where we see hormones coming into play. I'll mention just but a few, but it's important that we are aware that in as much as we are also going to be having the nutrition, we're also going to be having the other medical treatment, the aspect of our mind and behavior is also holistic, and it needs to be incorporated. So around the disorders that I've mentioned, we have the hormone cortisol. Cortisol is produced as a result of stress. And normally when cortisol is produced as a result of stress, when it's elevated, it increases cravings, it increases the appetite, it also allows for greater fat storage, also gives insulin resistance. There's also poor sleep, And when there's poor sleep, the hunger hormone ghrelin is released. And then also because there is constant fatigue, then your physical activity is also reduced. So when you're coming in, we are also assessing that other part to see that we are able to have, again, that holistic treatment. So there's that hormone cortisol. Then we have estrogen. Estrogen, of course, produced, it's a female reproductive hormone. Female reproductive hormone. And so with estrogen, it improves the insulin sensitivity. However, when the cortisol levels and the stress levels are high, it also influences the work of estrogen. So it makes it difficult for the sugar to be regulated. And so you're trying to lose weight and then you find there's perhaps a resistance. So we need to look at that as well. And then there's also the hormone called progesterone. So progesterone basically is a hormone that helps promote relaxation. It's like an anti-anxiety that the body, produces to stabilize our mood and give us restful sleep. However, again, when there is chronic stress, it suppresses this progesterone level. And so when the progesterone levels are low, again, we are having an increase in cravings for sweet things, cravings for, carbohydrates. And again, it's disrupting sleep. Why craving for sweet things, craving for carbohydrates, craving for comfort food? We always have comfort around our mouth. It's the way we are created, I would say, or nature has it. So that's one aspect. Now, when it comes to depression, we are talking about the reward system. So depression, we are talking, it's something persistent sadness for over quite some time. And you see, when this lady is perhaps going through that depression, even the activities they used to enjoy, they're not being able to enjoy them anymore. And so what happens, the weight gain can also come through food addiction and also some eating disorder, binge eating. So with food addiction is that you realize that food that makes you happy, you will try and eat it. But because you need to reach to that height of happiness, which depression is trying to suppress, you end up eating more and you end up eating a bit mindlessly. So you're taking in more to be able to reach to that part of reward that makes you happy. And more often than not, you'll probably be eating mindlessly, probably be eating food that is highly palatable and also, not supporting any weight loss. So that's a part of the reward system. The other part is the binge eating. Actually, in eating disorders, you realize it may come to binge eating. So binge eating can be objective or it can be subjective. What does that mean? After delivery, I may say I don't eat much, or probably I'll eat when I'm about to breastfeed the baby, or I know the baby is on, a timetable of sorts. And so I may eat little, but at the end of the day, when I count what I've eaten more than even my body needs to use. Or at the same time, I may eat at once that. So we are seeing an element of binge eating. So what am I trying to say? It is very important that as we are moving as a team in your weight loss journey, we are able to assess each and every individual, find out how is this journey for you, not just at afterbirth, but we also go before. Because sometimes when we have to unlock either anxiety or a stress-related matter or a trauma-related matter, sometimes it comes even before. And so you realize you've carried it even after. And in my experience working with women, there are times, not once, not twice, it's been a bit frequent, where we see I've tried everything, it's not happening, or maybe I've started and I created a plateau, and we have to unpack what I call back office. And once when we unpack the back office, then the weight starts going down. So it's important, as you're looking to get your bounce back after pregnancy, that we do it holistically. That's it. Thank you, Eva.
Thank you, Akinyi. I think you've touched on some very important aspects of, the mental preparedness and the mental awareness that is needed around weight loss after pregnancy. And I'd like to ask Margaret, in our culture, it's very normal that once you've had a baby, there's advice from your aunties, from your mother, from everywhere about what you should eat after pregnancy, not necessarily for weight loss, but also for milk production. from your perspective as a nutritionist, what are some of the eating habits or dietary habits that you have seen in postpartum mothers that are going to be harmful towards them trying to lose weight, while also not being so beneficial towards milk production? And which ones would you rather they adopt for both good enough milk production and also weight loss?
Thank you, Eva. I'm actually laughing because of that question, because I'm looking at the African, we are Africans, and Africans is our business. And in this context, there's that ideology where our mothers and our great grandmothers, they give the black beans, there's the bone soups. As much as these meals are so healthy, but you see, they don't do it in a point of portion control. So you'll find that a mother who is still lactating, doing the exclusive breastfeeding, rather than them losing their weight, the weight is adding. And this is how I'm looking at it. We need to have, the meal that is balanced, a diet rich in protein. Remember, as much as she's breastfeeding, the goal is weight loss. So we need to look at a plate that is a balanced diet, rich in protein, vegetables, fruits, and whole grains. And why I'm insisting on the whole grains, it's because it's not a refined sugar. That is a complex carbohydrate, meaning that you're going to get the fibers in your body. You're also going to get this sugar, that as much as sugar, the final product in our bodies is fat, but this is on a healthy aspect of it. And there's the aspect of healthy fats. Why? Because it needs to promote satiety and support the weight loss. And you find that most women or most mothers, they go to an extreme point of extreme dieting. And that's why at our clinic, as a nutritionist, I'll look at your plate. If an individual is extremely dieting, I'll be like, no, that one is negatively affecting your recovery, your energy levels. And there's one thing professor mentioned about the muscles. We need to still preserve our muscles. And we ought to remember that women, we tend to shed our muscles much faster compared to the men. So there's no need of extreme dieting. And, that is in addition to the breast milk production for the lactating mothers. So portion control, mindful eating, more effective than the restrictive diets. Eva, have I answered you?
You have. Thank you so much for that, Margaret. You've answered me, but I wish all the African mothers were here on this call. They're the ones who needed that advice more than us, because they're always telling you, drink a lot of porridge or eat a lot of this, eat a lot of that. Yeah. And so for Professor, I'd like to ask, if a mother is considering having maybe bariatric surgery or maybe a non-invasive one, or rather minimally invasive, like the ESG or the gastric balloon, will it affect their ability to conceive again? And when is the best time to consider having bariatric surgery after giving birth?
Thank you, Eva. It's a good question. Generally saying, there are no good so-called guidelines or recommendations, yes. But general, what is accepted is that, for instance, if we are talking about some more invasive procedures, that is above medications, but I told already about medications, that is and that's not recommended while breastfeeding. So very similar recommendations are actually with invasive procedures, that they are not recommended for the woman when they are still breastfeeding. So they have to stop breastfeeding, and then after 1 month, they could be eligible for weight loss procedures such as endoscopic procedures. Yes, it could be balloon, it could be endoscopic sleeve gastroplasty. For bariatric surgery, also there are quite similar recommendations that the woman should not breastfeed. And as I said before, it should not be even 6 months. So after 6 months, when at whatever point the breastfeeding was stopped, then could be already planned weight loss, other weight loss solutions than nutritional help or physical activity or behavioral therapy. So this is approximately how it looks like. Why? It could be, question why are recommendations like this? But this is also the same because it's not good to do any of this more invasive procedures while there is breastfeeding because of these procedures does that they restrict food intake, and this could have a really serious impact on the milk quality. And as I mentioned previously when I talked about medications, milk quality is also very important for the development of your baby. So to answer this, I would put that way, but also I would like, if you have given Eva for me the word, I would like to mention few recommendations about physical activity. What is the timeline and how is recommended? So usually early period is like up to 6 weeks. So it is recommended like gentle physical activities, like deep diaphragmatic breathing, and it's important pelvic floor exercises like Kegel's exercises. And then already after 6 weeks, it's it depends if it's natural delivery or cesarean section, but still even after cesarean section is recommended to start light exercises. From these exercises, it's one is pretty easy and I think it's important is walking, and because this is like it could be a little bit faster working and a slow impact cardio exercise, but also it could, and the woman can start with low impact aerobics like swimming or cycling, and even on stationary bike, and this I think is a very excellent way also to burn the calories without stressing the joints. So swimming and cycling are very good, and always and for maintaining your muscles and muscle strength. It could be as simple exercises as wall push-ups or body weight squats, just doing a squats. So this like allows to maintain your muscle mass and elevates your resting metabolism. So this is, Eva, what I wanted to tell on top of other weight loss, more invasive weight loss methods.
Thank you for that, Professor. That is a very good addition to what you had mentioned. I want to ask one more question to Akinyi before we enter our question and answer session. As much as we talked about the do's and don'ts and the options that you have for losing weight after pregnancy, of course, the body of this postpartum mother has changed. So how important is it to reinforce the acceptance of the changes in her body? She looks different maybe at this point, accepting that stage in her life and what to expect if she's going to start her weight loss journey.
Mhm. Thank you so much, Eva. It's very important to practice what we call empathy to self, because it's understanding that your body began a journey and it has been changing, and it also, for it to quote unquote restore factory settings, it needs a particular process. Because sometimes when we are just engrossed in, having the quote unrealistic, remember, for example, if you're a C-section, mom, if we exert too much activity before time, before clearance, it affects the healing of that wound. And more often than not, I've worked in maternal health, and I'll tell you now, for example, if it is any wound, whether it's a C-section or if it was a natural birth and we needed, any wounds to heal, when we are battling with trying to exert pressure on this body, whether mentally, whether emotionally, it delays the healing of the wounds. So trying to understand, this is where my body is, this is what the doctor is recommending, let's move in strides, allows it to not only serve you better for maybe the next time that you would want to prepare for birth. So it's very important to just sit and say, can we set, just have realistic goals and also appreciate small wins. What are small wins? When we are with our patients, I normally say there is the visual and we can be very engrossed in the skill, but we have the non-visuals, which are very, very important. And I always say they reflect fast and then they are followed by the skill. What are the non-visuals that you have noticed once you're starting this weight loss journey? Professor mentioned the healthy eating lifestyle program, and it's that program that allows us to set those goals that are very unique to you, like your fingerprint, and also together with Margaret, setting that eating routine, that diet routine that is specific to you. Why? Specific to your age, specific to your height, specific to your goals, and how your body is able to meet this goal. So it's very important to remember that you have been through that process and practice some empathy on self. It goes a long way. Thank you, Eva. And maybe if we have some questions, you can use the chat box or you can raise your hand. You are welcome to take any questions. Any questions? And as the questions are coming in, there's also something I always engage the patients in, and something that you would also think about as you start your weight loss journey. What is your why? I normally tell people to write 15. They may not be 15 reasons, but what is your why for wanting to lose this weight? What else is it in for me other than just to look, snatched and, sizes smaller? What else am I looking to achieve with this weight loss? What else is motivating me to be able to want to lose this weight? Am I doing it for myself? Am I doing it for others? Is it for a partner? What is your why? It's very, very important. So we are welcome. Are there any questions? You can type it on the chat box and we'll be able to answer you.
Maybe in addition, Akinyi, I would love to add, as they think of the questions to ask, I would love them to just ask themselves, what is the biggest challenge after pregnancy? Yes, and in a question for them, that will give them a question to ask.
Okay, thank you, Maggie. But maybe, Maggie, I will ask a question. How do you handle the myth we are eating for two? I'd like to hear that from you.
Tunakula ya watu wawili.
Angela has thumbs up. Yes, tunakula ya watu wawili na akitoka,
Yes.
is it bado namkulia? And for how long?
And for how long? I'm telling you, the MCH, maternal child health care, and in relation to the antenatal clinic, is one interesting department, because those are the questions that I keep on hearing. Maggie, I'm eating for two. And the person who is eating for two, the child is 1 year plus. So this child has already done this child has already done the exclusive breastfeeding, meaning that so long as that infant is already past the 6 months, there's no way you're eating for two. And remember, again, as much as you're eating for two, you need to do it in a balanced way. When I tell you, go have a balanced meal, I'm not telling you to go have 2 feasts of ugali or 200 grams of rice. No. You're eating for two, correct, but do it in a balanced way. Ensure that half of your plate is vegetables, starchy vegetables, a quarter of it, the complex carbohydrates. Always remember, complex carbohydrate, whole ugali, whole pasta, whole rice. And then the part remaining, that is the protein. And proteins, we have 2 types. We have the plant protein and we have the animal protein. So eating for two, yes, but do it in in a very healthier way, because we don't want this switch to stick for you. We want this switch, you shed it, and it's doable. And also putting in mind that breastfeeding increases the energy expenditure. So if you always think about it, breastfeeding also increases your appetite. Thank you, Akinyi.
Thank you so much. Maybe we have, I'd just like to welcome, I see Angela, I see Leah, I see Marion. You're welcome to please just type any questions I see Joe Gisiri. You're welcome to type any of the questions that you've been having. Karibu sana.
So sorry. Thank you for continuing on my behalf, patient Hopsin. But thank you. Continue.
We are asking for questions, so I was just welcoming. I see there's Leah, Marion, there's Joe, there's Angela, there's also Timothy. So you're welcome. Please ask the questions, and we'd be glad to answer them. But we are also open for consultation. So if it's something you feel you're not able and comfortable to ask, you can reach out. I think I'll put our numbers here. I'll put it on the chat box. You can save that number and be able to have further inquiries on that, and also any questions. Thank you. Thank you so much. I see a question from Leah. Leah, thank you so much for your question. And she asks, how do I overcome the cravings for sugary stuff, though I'm 2 months postpartum? Okay, I'll answer that, and I'm sure Maggie will also give, and the team may give their insight on that. From a bariatric counseling perspective, is that we say behind every behavior, there's a feeling, behind every feeling, there's a need. And so we would like, what I normally walk through my patients ask is, when do the cravings come? What are you craving? That's one thing that I ask to go and reflect on. Then we are able to see where this comes from. Why? Because there is normally some behavior that is influencing, for you to be able to reach out to that particular craving. So now, how do I overcome the craving? We need to understand, why are we even having that craving in the first place? Remember, when I mentioned about just the mental wellness aspect and also the hormonal aspect, a lot is happening. While we are not going to change the situation, we have this bundle of joy happening around us, but we see how to manage ourselves around this. And we also have what I call replacement therapy, that once we understand you, we understand what you like eating, then we are able to do what we call replacement. But you also need to have the awareness. Maybe, thank you so much for the questions. Maybe Margaret, you can have a comment, or the team, anyone in the team. The question is, how do I overcome the cravings for sugary stuff, though I'm 2 months postpartum?
Okay, thank you, Akinyi, and congratulations on the 2-month milestone, Mama. Congratulations. And why cravings hit hard at that time? Because there's one thing Akinyi mentioned about the hormones in your body. Once the estrogen, the progesterone has dropped, and you're breastfeeding, so the prolactin hormone has increased. So you see the insulin and the serotonin in your body has been affected. That's why you see craving at that time hits hard. And then there's the aspect of you're breastfeeding, you're a mother, you're a wife. You see, so meaning, look at also the side of sleep. Are you getting enough sleep? Because if we don't get enough sleep, meaning that the blood sugars has been affected. So that means your brain is having the sleeping inadequate. And there's one thing I always say, that if our energies are low, that means that the body will ask for the sugars. And always believe that the last meal one has had the previous night will determine the energy for the next day. And then there's the aspect of your breastfeeding. So your body right now is on a calorie demand, calorie meaning the energy, and food is fuel for our body. So ensure that you're not under eating, so that your body not to burn the meals or the calories that you're eating in a very fast pace. And then look at sleep. Ensure that you're having adequate of sleep. In relation to nutrition, have that consistent eating routine. After maybe 3 to 4 hours, ensure that you're having something. In the house, there's a snack, a healthy snack. It can be a fruit, an apple, a protein smoothie, a chicken, something that you can lean on to. Because you see, when you're in the house and you do not have something healthy at that time, there's always a higher chance of leaning more into the comfort food. And when your cravings, we are women, at that time our mind is not thinking about how I'm going to eat some kundes or tereres. There's a higher chance of you reaching out to the cookie or some kebab somewhere. So always ensure that in the house you have packed quality food. So eat every 3 to 4 hours so that your energy is not to go through the sugar crash. Thanks, Akinyi.
Thank you so much, Margaret. Thank you so much. Marion, thank you so much, and Karibu. So Marion is asking this, I will share it to Professor Almantas. My question is it possible to lose weight while exclusively breastfeeding during the first 6 months? Any tips?
Yeah, for sure. It's possible. And this has to be done because, as I mentioned, if you retain that weight, is much more. First of all, it depends how much weight you regain. Yes, it's if it's only a few kilograms, then it's another situation. We are talking about people regaining even 8 or 10 kilograms. That is important to lose. So better is always not to gain during the pregnancy a lot of weight. But if it's happened, it's also key, as I mentioned, this 6 months. So I think this is more, not exactly to me, this question, to all of us, because I think Maggie already talked about the cravings. She talked about regular eating, yes, that you have to eat like every 3-4 hours, maybe. And from my side, if you ask, I would still argue that you should take more proteins, because the protein gives for you satiety. And even about the cravings, when we are talking about the cravings, we have to look at the proteins. So it could be healthy proteins, it's like a shake. It could be like a powder putting in some food, but it could be also, the chicken, the meat, the milk products rich in proteins like cottage cheese. So it's very important. My tip, if I would to give the only tip, I would say try to eat as much as possible proteins, and then also try to do some exercises, because as I mentioned, especially this, like having a bicycle ride a little bit, or even swimming, because or even, as I said, push-ups, whatever, because this exercises gives to you also some sort of control a little bit on your schedule, because you are not eating before exercises. Try not to eat directly after exercises, because after exercises still the body is burning the calories, and it's not good if you take some fast calories, because then the way or the calories you have spent, you've got immediately back. So this is how you have to put. And then what is recommended, it's about 30 minutes to 1 hour. If it's light exercises, it could be 30 minutes. You don't eat before exercises, then you exercise, and about 30 minutes you don't eat. But afterwards, when you eat, you again look for more proteins. And this is good for milk, for breastfeeding, but also is good for you, for your satiety too. And there was the next question also from Angela about breastfeeding hunger. So it's normally that you are getting this hunger, but it's not normal, for instance, if you are taking too much sugar or too much carbohydrates. So you are getting, it's not only breastfeeding hunger, but you are getting also this hunger because of this rapid uptake of the calories, sugar stimulating your appetite, so you want to eat again, and you are landing in this circle. So my tip, if you ask for the only one tip or two tips, is proteins plus exercise.
Thank you so much, Professor. Margaret, you're nodding before I also add. She was nodding and smiling. So, yes. Can I be able to lose weight with exclusive breastfeeding? And my main challenge is breastfeeding hunger. And in Kiswahili, the way you say, nikimaliza kunyonyesha nasikia kukula, you know? So, Margaret, what's your take? What's your tip?
My tip for breastfeeding hunger, the same, ideas that Professor has shared. Pick foods that fill you, quicker and help the milk supply, and that is protein. So ensure that your protein goals are top notch and reduce on the sugar, And there's always one thing that Akinyi you said during your sessions: feed the hunger before it bites you. Because one thing I'm meant to understand is that we have different types of hunger. So from a nutrition point of view, if you feel hungry, first, I usually say, take a glass of water, because other times thirst masquerades as hunger. You might be thinking that you're hungry and yet you're just thirsty. So when you feel hunger, take a few minutes, have a glass of water. And if still the hunger persists, then that's a point to now have your meal.
Thank you so much for that, Margaret. Two things perhaps I would just add. There's something Professor mentioned about the physical activity. Physical activity is known to be able to manage hunger. We say manage hunger. Why am I saying manage hunger? Because we need to identify what kind of hunger am I feeling. There are normally two types of hunger. There's the physical hunger, the one your baby has. You realize you've put this baby on a schedule. Perhaps as they start, it's after every three hours you're giving this baby. Then I think the Kenyan way is that there is breastfeeding in the morning, or there's food in the morning. 10 o'clock, I think there's milk. 1 o'clock, there's lunch. 1, 2, 4 o'clock, maybe there's some uji, and then dinner, and then 10 o'clock. So what are we saying is that there's physical hunger, and there's also hedonic hunger that's triggered by the mind or routine or memory. So as we try and manage our hunger, we also need to know what kind of hunger am I feeling. And that's one of the things we actually help our patients identify. And this one comes across board for each and every person who's seeking their weight loss journey. We need to identify what kind of hunger are we experiencing. And what Margaret has mentioned, she has mentioned feed the hunger. Yes, we need to know how do I respond to the kind of hunger that I am experiencing. So it's very important at that point to try and identify what is the hunger, and even how can I be able to manage that hunger. Let me see, there's another question. Okay. Leah says, thank you. This was very insightful. Marion also says, thank you. Any other questions? Then any questions, any comments? Okay. I think as we wait for Eva, also just appreciating that you would find your time to be able to be with us for this hour, and also for your questions. Please keep them coming. Again, let me read out the number. This is a number that you can either reach out to find out more about us, to book a consultation. It's 0711 728 728. So I'll put it here, 0711 728 728. We are located at Park Medical Center. We are on 4th floor, Nord's Weight Loss Clinic. We have our consultations. Consultations are online and they can also be physical, and you're welcome to share that. You can also find out more about us on the internet, nords.ke. If you fill that in, it brings you to our website, and you can find out about other services that we have that you can be able to engage in and also inquire in. And we also request, leave us a Google review, how you found the, the talk. Was it informational? And we would be very, very happy if you did leave a Google review for us. We will share it also on email and also get to hear your feedback. Thank you very, very much. Maybe a parting shot from Professor Almantas and Margaret.
Thank you, Akini. I think it was really very interesting discussion and a lot to learn. And we really encourage you to choose this path and try to lose the weight, because this weight loss has a great impact on your health. So you have to go for this for sure, to be able to enjoy and play with your children and grandchildren later on.
Thank you. Thank you, Professor Margaret.
Well, every woman's postpartum recovery weight loss journey is unique. So my take home is that always ensure that you have a good support system and always seek professional guidance from the professionals.
Thank you, Margaret. Thank you so much for that. And for me is that appreciate. So
I think Akini got frozen. Okay. Akini cannot hear you well because of maybe your internet connection. So, okay, no. Okay, Margaret, so you can say the last word and we are finishing. What Akini have not managed to say.
Yes. Okay, we have Akini seems to be having network issues. I've talked to her, but I do appreciate all of you for taking this time. It is an evening, and we all hoping to have a rest this evening. So I do appreciate all of you taking this time to be with us, and I'm hoping that it has been a quite insightful session for all of us. And as Akini shared, you may always reach out to us. You may always come to our office. We are open Monday to Saturday, and we'll be glad, to have you and have your friends also be welcomed. And thank you a lot. Okay, so I'll allow you guys, as the nutritionist, I'll allow you guys go have dinner, eat healthy, and remember, do your physical activity. Have a grateful night.
I am at the conference. I'm going for conference dinner, and wish you everybody also a good dinner. Bye.
Okay, bye. Thank you, everyone. Goodbye. Have a great evening.